Good day. Today I'll be presenting on the research behind early detection and PPH treatment and the role the ALV products have in play. Sorry. Okay, just to show where the ALV products are being used. Globally, it's being used in 46 countries. 73% of Africa is using both of these products, and more than 8,654 healthcare workers have been trained in the last 2 years on the ALV products. So where do they fall in? According to the WHO, according to the WHO protocol for PPH management, you have the emotive management protocol. We fall in with the ALV drape with early detection, which is the first E, and of course the last E as escalation for the ALV uterine balloon tamponade. So let's start with the detection, early detection of PPH. The current issues is that we are using visual estimation. When you're working with visual estimation, you most often underestimate blood loss by 30%. This leads to a delay in treatment and, of course, leads to worse outcomes for your mother, not only mortality, but morbidities. How often we forget that severe blood loss leads to an increased risk of postpartum depression, increased risk of anemia, inability to breastfeed, and the general health of the mother is severely affected for the next 5 years. PPH is defined as 500 milliliters of blood loss. And the emotive trial, as well as FIGO, who actually updated their protocol last week, Sunday, said, updated that a mother who has lost 300 milliliters of blood and has an abnormal observation, such as anemia, or is underweight or abnormal HB levels, you will start your PPH protocol already by 300 milliliters of blood loss. The outcomes of the emotive trial showed that using an early detection device led to improved detection of PPH, led to a reduction of severe PPH by 60%, reduced the need for blood and blood products by 40%. In the emotive trial, they actually used a surgical drape. So what also came out after market research is that there were some problems using the surgical drapes. With no field of obstetric adjustments, the current field had leaks and limited orientation, and there was difficulty for safe disposal of the blood content. So the Gates Foundation approached Sanapi Biomedical, where we did research to make a drape specifically for the maternal ward. After doing more than 168 interviews in 45 hospitals in 5 countries, we produced more than 150 iterations of the drape, testing 700 drapes before we finally came to the ALV drape. The advantages of it was you had visual observation of blood loss at a glance. It was suitable for both delivery beds and standard beds. It gave you a field of freedom of orientation, and of course, ability to dispose without contamination, cross-contamination. So the solution was the ALV drape. So what was the feedback from the market of people using it? So where you can see with Mali, Cameroon, and in South Africa, they said it was a very good decision-making tool. It helped people to make important decisions when it came to diagnosing of PPH. It helped preserve the patient's dignity while preserving a clean setting in a resource-limited setting. So it's more hygienic and helped with diagnosis of PPH. Next is escalation. So the ALV UBT, where does it come in? It is used to firstly treat an atonic uterus, but not only that, it's used to temporize bleeding. So if you need to transport your mother to the next level of care, you can use the ALV UBT to stop the bleeding. Because, of course, we sometimes forget the main challenges or the main objectives when it comes to PPH is first to stop the bleeding and of course contract the uterus. If we do not stop the bleeding as soon as possible, we increase the need for blood and blood products. And this, of course, can lead to fatality, so mortality. And of course, as I mentioned before, morbidities. So according to ProFocus's study in 2018, we saw that most mothers are dying either waiting for transport or during transport. So 20% during waiting for transport and 14% during transport. So there's evidence that the LV-UBT reduces maternal mortality with an 85% success rate and can be used at all levels of care and is ideal for transporting patients. How does it work? It's based on the hydrostatic principle. By simply lifting or lowering the supply bag, you can adjust the pressure being applied on the uterus. As you can see in this picture over here on the screen, it applies equal pressure on the uterus, making a seal with the myometrium, stopping the bleeding within 45 seconds, making it ideal for NVDs as well as cesarean sections. Additionally, it is a free flow. So as we mentioned, the objectives for PPH is to stop the bleeding and of course get the uterus to contract. So it's free flow, meaning we're not stopping the contractions, but rather allowing contractions, because as the uterus contracts, it can push water back into the supply bag. So it can be used in combination with your uterotonics, as well as all levels of care, and is ideal for transporting a patient as well. So what is the clinical evidence? So if we're looking at the clinical evidence specifically on the LV-UBT, you can see from regional to rural, it's successful from 79% to 90% of the time. Looking at implementation studies, it's a simple, sustainable intervention. We're looking on comparative studies. The LV is the simplest, easiest, and fastest compared to all other UBTs on the market. The FIGA, or the International Federation of Obstetricians, also recommend the use of a UBT, not only for NVDs, but also for cesarean sections when dealing with an atonic uterus. This slide here is to show you a real life case. So this was not a study, but rather data straight from the government's database. In 2019, Rebecca Motete, the midwifery president in South Africa, decided to implement the LV-UBT at all levels of care in her district. Unfortunately, you see in 2022, there was 2020, there was an increase. That was due to COVID. But we are happy to say that in 2023, they have completely eradicated maternal mortality due to PPH in her district. As I mentioned, this is real life data from the government, not a study. So just some testimonials of people using it. This is from all levels of care. Everyone mentioning that they have seen a significant reduction in maternal mortality, regardless of what level of care. As you can see here, with low middle income countries, such as Burkina Faso, Uganda, Ghana, and even Mali, all of them says that the LV-UBT has been saving mothers, not only with midwives using it, but also doctors. And it's ideal for transferring a mother and saving the mother's life. So how do we make an impact with LV products? Firstly, is by making sure it's included in the protocol, ensuring the availability. That's why it's both on the UNICEF and UNFPA catalog. And of course, by supporting our midwives and OBGYNs by having the product in country. As you can see, this is just a real life example of people using it. We have more than 1.5 million drapes have been used so far. As you can see, the mother unfortunately had PPH in the picture above, but was luckily being able to be treated with LV-UBT below. Thank you.